do that one more time. Welcome to the Vulva and Vagina Dialogues, everyone. My name is Shirley Weir. I'm the founder of Menopause Chicks and a menopause expert, a fierce women's health advocate, and also an advocate for ensuring that you have all the information that you need to navigate your vulva, vaginal, urinary, genitourinary, and pelvic health. The reason I have this picture up first is because I realized something last fall. I was doing some speaking events in Ontario in October, and I was on stage for the National Menopause Show in Toronto on International Menopause Day, on World Menopause Day. And I put three pictures up onto the screen, one of my daughter, one of my sister, and one of my mother. And I had the honor and privilege of sharing parts of their health journeys. It turns out those stories really resonated with the audience. And the story that seemed to land with all of the folks who were at the National Menopause Show that day really came back to me in the lineup after my talk about my mom. So this picture is actually 26 years old now. I got married in 2000 and my mom passed away in 2008 at the age of 80. But this story that I'll share briefly with you today is that my mom, and we knew this, suffered greatly from dryness. She suffered greatly from dry eyes, dry mouth, dry skin. She had skin conditions such as rosacea, vulva and vaginal dryness, and reoccurring UTIs. After she passed away, we got a copy of her health records and found out that she had been to her doctor a number of times to discuss varying degrees of the list that I just gave you. And she was never offered a solution. Prior to my mom passing away, she was being treated for dementia. She was receiving medication to slow down the progression of dementia. When she died, my sister and I did order an autopsy. We don't remember why, we just did it. And I will never forget when the coroner called us. We were at the funeral home, and he said, "Your mom showed no signs of brain decay or decline." Now, this whole connecting of the dots, what if, what happened, I really can't put a lot of energy into, is this true? But I can share with you that this is the truth. I know that she didn't have dementia. I know that she was being treated for dementia because she was showing signs of cognitive decline, memory loss, forgetfulness. But I also know that alongside of this, she had a long history of reoccurring UTIs, some of which at certain parts of her life were treated with antibiotics. And I believe that probably in her last few months, at least, probably 2 years of life, she had untreated urinary tract infections. Now, in older people, you may or may not know this, but first of all, urinary tract infections can impact someone at any age, any stage, and any gender. But in older people, particularly, symptoms of urinary tract infections can show up as cognitive decline, forgetfulness, memory lapses. And so often our older people will get sent down a path of dementia investigation and even treatment, like my mom, and they might not have dementia. Now, dementia is not 100% diagnosed or confirmed until after someone dies, hence what we learned after our mom died. What I didn't know when I started this Menopause Chicks journey was the impact of estrogen decline at menopause, after menopause, and for the 3 to 5 decades that we live beyond menopause, how much that impacts our urinary or urethra health. So, quick masterclass lesson to get started. When estrogen declines at menopause, the urethra gets shorter and smaller. The urethra is just skin, it's part of the vulvar skin. And our skin relies significantly on that estrogen production that we have during our reproductive years. When the urethra gets shorter and smaller, it's more susceptible to infection. And the most common type of infection is a urinary tract infection or UTI. That's why when we say that urinary tract infections can impact anyone at any stage, any age, any gender, but when you actually look at the statistics, there are over 11 million urinary tract infections diagnosed every year in women postmenopause. That's been my learning. And the reason why I wanted to share this with you is because I knew that it landed with so many people at this show that I wanted to share it with you. Now, I thought I would kick this off with a personal story, but really, why are we here tonight? Well, the ultimate goal for this edition of the Vulva and Vagina Dialogues 2026 is to make sure that you have a clear understanding of what causes changes to our genital urinary health and that you completely understand what is on the menu when it comes to preventing and treating those changes. So that's my goal. We will have a live Q&A at the end. I also have script tips. If anybody, my formula for script tips, if anybody is preparing to go to a health appointment and they would like to work through that, we can do that either during the Q&A or at the end. But let's get started. So as I said, what we're going to be talking about is vulva and vaginal and urinary and pelvic health. I think probably everyone on this call knows what I'm talking about when I use those words. However, I think it was 2018 or 2019, the North American Menopause Society, it's now just known as the Menopause Society, stopped using phrases like vaginal dryness and vaginal atrophy and reframed the whole category into what they call genital urinary syndrome of menopause. It's a mouthful. And so then, of course, they gave it an acronym, GSM, which not many people that I work with on a regular basis know or speak of. I've never, ever had someone in the Menopause Chicks community say, I think I'm showing signs of GSM. And I bet that no one has ever gone to their doctor and said the same thing. So where am I at in terms of this language now? Well, I don't like syndrome of menopause. Those of you that follow Menopause Chicks will know that I'm a real word nerd and very particular about language because I think it provides, either the obstacle or the bridge to us getting the health care that we need and deserve. So I don't, but I have adopted genital urinary because it is a nice umbrella term to talk about the entire pelvic floor and all of the parts. But then what I love even better is to refer to it as genital urinary health because it's very positive. It's not all about symptoms and syndrome and suffering, but let's talk and let's celebrate our genital urinary health. So where do we start? Well, this is a quick overview. Those of you that have watched the Menopause Chicks Masterclass, you will know that I use this snapshot in time. It's a very generic, generally speaking illustration, but it really helps to show us that in puberty, estrogen fluctuates a little bit as our body is preparing to ovulate. And then the big section in the middle are reproductive years. Estrogen and progesterone are fairly even Steven doing their thing. And then when we get to perimenopause, you'll see The purple line, which represents our estrogen or estriadol, which is one of three kinds of estrogen that our body makes during our reproductive years, it begins to fluctuate. And it can fluctuate quite wildly during the perimenopause years at the same time while progesterone is going down. This could be the first time that many individuals will experience changes to their genital urinary health. And it could be in the form of dryness, which is the most common, but it could also be in the form of more frequent urinary tract infections or other changes to our pelvic health. There's another time in our life where we might also experience dryness before we get to perimenopause, and that could be during postpartum as hormones are fluctuating, or, and I've got a list on a slide that I'll share with you, things like the birth control pill. But for the context of tonight's conversation around menopause, it's perimenopause where these changes could begin to show, and then maybe they'll go away because our hormones are fluctuating, week to week, month to month, year to year. When we hit menopause, which is the end of ovulation and usually defined by the end of our periods, that purple line goes for a steep decline. And when estrogen goes for that steep decline, that is when our future, current and future genital urinary health is going to be impacted. In the masterclass, I use the watermelon because I just like to remind everyone the roles and responsibilities of our hormones when cycles are regular. So when our cycles are regular, estrogen is doing all kinds of things. It has over 100 roles and responsibilities. It's protecting our heart and our brain and our bones. And it's also our juicy hormone. So it's taking care of the moisture in our eyes, the moisture in our mouth, our skin, and our vulva and our vagina and our urinary health. So, why do we want to talk about vulva and vaginal health? Well, lots of reasons. And, I have colleagues who will teach this information, and they'll usually begin with a list of all the ways in which women might suffer. And I take a different stance. I like to begin with, let's talk about the positives. Why do we want to prioritize vulva and vaginal health? What brought you here today? Well, the answers are because we all want to be able to sit comfortably, move comfortably, dance, wear the jeans that we want to, avoid urinary tract infections and all of the discomfort and inconvenience that could go along with that, avoid incontinence and pelvic organ prolapse and all the discomfort and inconvenience that can go along with that. We want to be able to enjoy comfortable, insertive sex if we choose, and we all deserve to feel amazing. The one thing that really kind of hit me hard in the learning that I had throughout, the last 13 years that I've been doing this work is early on, I would meet a lot of individuals who were in, I'm just going to cross my fingers and hope for the best. Or maybe they were white knuckling it. They're like, I think I can get through this, as if it's something to get through. And so I think that this slide is very important, especially maybe if you're sharing this information with people that you love, your friends, your sisters, your mothers, your grandmothers. And that is that concerns related to genital urinary health do not get better with time. That estrogen tail, that purple line on the graph I was showing you, it never resumes. After ovulation, we are not making the estrogen and progesterone that we once did. And so our current and future health is at jeopardy. The other reasons why we want to prioritize this is, for example, we don't want anything physical to impact our other areas or other qualities of health, such as if we're not, moving and dancing and going to yoga and going to exercise class, then our brain health could suffer, right? If we're not able to wear jeans, and believe me, this is a thing, I've spoken to women who can no longer wear the clothes that they want to wear. We can't wear the clothes that we want, or if we're dealing with reoccurring UTIs, And, for some of you, that might sound like a couple times a year. I've actually met individuals who have had UTIs in the double digits per year, like 12, 13, 14, 15. That essentially means that they have a chronic infection the entire year, which is going to impact their overall health. We want to avoid that at all costs. And hopefully, what you're hearing today, you can also take with you to your conversations throughout the week. The other thing is that we have to consider the cost. So this is costly if we are, maybe 40, 45, 50, starting to leak urine. Oh, they call it light bladder leakage. But if you actually add up the cost of paper-based incontinence pads from age 40 to 95, that's a lot of money. And we have a slide on that as we go through. So, and it's, costly financially, but it's also costly to our well-being and to our social lives. We want to reap the benefits of pleasure and we want to feel amazing because that's essential. So this slide talks about what causes vulva and vaginal dryness. And there's a couple of key reasons that will probably apply to all of us. And then there's some additional reasons that could contribute to vulva and vaginal dryness. So number one is a decline in hyaluronic acid. Hyaluronic acid is not really an acid. Talk about language and being a word nerd. Hyaluronic acid is a naturally occurring molecule that our body makes on its own, and it too helps to support the moisture in our eyes and our mouth and our skin and our joints and our vulvas and our vaginas. But hyaluronic acid production starts to decline in our 30s and in our 40s. So that's one reason that skin changes happen around those perimenopause years and beyond. Second culprit for or contributor to vulva and vaginal dryness is fluctuating hormones in perimenopause. So that's the purple line that was going up and down. And then third is the decline, the steep and sudden decline of estrogen at menopause or postmenopause. So postmenopause is going to be for most of us, the end of our 50s, all of our 60s, all of our 70s, all of our 80s, all of our 90s, and beyond. And that's a long time to live without both a molecule and a hormone that your body was really relying on to keep those systems healthy. Postpartum, as I mentioned, can also be a reason why you might be experiencing vulva and vaginal dryness. I share this at every session because we probably all know someone who is postpartum, but if they're experiencing vulva and vaginal dryness, they may think they're the only one. And so I think it's really important if we can crack open that conversation so that they already have a lot on their plate, right? And so if we can get them the tools and the information that they need so that they do not suffer with that as well. The birth control pill, is a form of taking hormones when when our body isn't screaming for them, can set an imbalance and that it's going to contribute to some side effects. So some individuals do report changes to vulva and vaginal health. Anyone who is going through breast cancer treatment might experience vulva and vaginal dryness. Other medications have side effects that can show up as changes to vulva and vaginal health, other health conditions. And this last one, which I actually learned from my daughter years ago when she was in high school, and she was telling me about how everyone wore a panty liner every single day. And I'm like, what? I didn't know that. And yeah, so the chemicals in paper-based panty liners are actually withdrawing natural moisture out of the skin cells of the vulva and the vagina when we're wearing panty liners. So spread the word on that as well. Also, if you're using paper-based incontinence pads, know that there are alternatives that you could switch to, such as like a leak-proof panty. The brand that I have followed and worn for years is called Knix. So Knix, Knix.ca. It's just really better for our skin and for all the air circulating. I think I explained what hyaluronic acid is, naturally occurring molecule. It's also really the strongest molecule when it comes to moisture. It can carry 1,000 times its weight in moisture, and super strong. And then estrogen I talked about. So what can we do to prevent vulva and vaginal dryness? So I put a couple of markers on here, a couple asterisks and a couple check marks, and I'll explain those in a second. I put sexual activity at the top of the list, but it comes with an asterisk. So sexual activity with or without a partner sends energy and blood flow to the pelvic floor. That is good for overall pelvic health. The blood flow is very beneficial. But if there is any discomfort with sexual activity, do not participate. Just press the pause button and know that there are ways in which you can treat that so then you can resume sexual activity. And I say that because you can do whatever you want, right? But I don't want women to be white knuckling or trying to get through it, or just thinking it's going to get better with time without getting the information and the treatment options that are available to them. So asterisks besides sexual activity, but know that that blood flow is very healthy for all of us at all ages and stages. Regular pelvic floor exercise. I'm also a huge advocate for working with a pelvic floor physiotherapist. Or if you're in the United States, it's called pelvic floor physical therapist. These are physical therapists or physiotherapists who have a special designation in working with the pelvic floor. They're experts at providing custom exercise programs for you. So it's not an assumption that everyone is too loose and needs to tighten up. That's not it. Many of us need to learn how to relax. Many of us might not even have concerns about vulva and vaginal health, but we might have back pain or hip pain that's related to our pelvic floor function. So we can talk about that in the Q&A if you need to, but regular pelvic floor exercise does something similar to what we were talking about with sexual activity in that it's sending energy to the pelvic floor, blood flow as well, and very good for our vulva and vaginal health. Moisturize with hyaluronic acid. That has a blue check mark. This is the first line recommendation from all of the menopause societies worldwide, from the International Society of Gynecologists. They talk about moisturizing as the first line. It's non-prescription, so it's something that individuals can use in a prevention and a treatment mode, and it's a great way to get started with prioritizing vulva and vaginal health if you haven't yet had a conversation about hormone therapy, which is next on the list. So hormone therapy that's taken systemically, that would be hormone therapy to benefit all of our system, like estrogen, progesterone, that could have some positive contributing preventative factors for vulva and vaginal health. Now, I say could have because it's probably something that would maybe benefit an individual in perimenopause. So if you're using systemic hormone therapy, but you're still in perimenopause, you may not have got to that steep drop off of estrogen yet. Okay. And that's why it could be part of a prevention strategy. Vaginal or localized hormone therapy, that's a type of hormone therapy that's applied locally. Look at how empty this is. Um, Vaginal hormone therapy that's applied locally to the vagina. And in this case, it's a cream, so it could be used on the vulva as well. Very effective at preventing vulva and vaginal dryness. It's also going to be on the next slide, which is the treatment slide. The last two bullet points on here are red light therapy used at home with a device. You may have heard of the Joylux or the V-Sculpt. It looks like a vibrator, but it's actually red light therapy. That is Health Canada and FDA approved for use. And then there's laser therapy that is sometimes offered like it's in a physician's office, offered by a physician or a gynecologist. That is not FDA or Health Canada approved. And it comes with quite a bit of a higher price tag than these other options, but also it's not approved. So it's really good if you can stick to what's available and approved for prevention and treatment. So what changes on this slide when we move to treatment options? Well, I took sexual activity right off the list because if you're now at a stage where you need to treat vulva and vaginal dryness, just press pause on sexual activity until it is comfortable for you to do so. And that could be very, very soon if you take the next steps in terms of moisturizing and getting curious about the benefits of localized estrogen therapy. Definitely recommend seeing a pelvic floor physiotherapist because you can have a conversation, you can get a an assessment, like a visual assessment if you like. You can rule out things like maybe you have a vulvar condition like lichen sclerosis. I don't get into too much of that tonight just because of time, but if anybody needs resources around vulvar conditions, I can send that to you. You can talk with your pelvic floor therapist about the benefits of moisturizing. They can't prescribe hormone therapy though, so you would need to talk to your doctor about localized or vaginal hormone therapy. And then, of course, I kept red light therapy and laser therapy on this list because some women, some individuals who have maybe experienced a cancer journey, they might be in a position that is just different or further along than what you're at, and they're looking for as much support or to try different supports as possible. But same thing applies. Moisturizing with hyaluronic acid and using localized vaginal estrogen, especially if you've already passed menopause. If you're in postmenopause, it's vaginal estrogen for the rest of our lives. So, three things. One, moisturize with hyaluronic acid. That's the first line recommendation from all the menopause societies. Two, have an investigative conversation with your healthcare provider about the benefits of localized hormone therapy for you. And I'm going to walk through what is on the menu so that at least you have an idea when you're talking to your doctor and or your pharmacist and or your girlfriends about what the best option is for you. And sometimes it can get a little bit confusing. I try to flip that around as well and say, yes, it can be confusing, but we're smart and savvy and we can figure that out. But also, there are a lot of choices on the menu. And I think that's a good thing. Anytime we have choice in our treatment options, it's a good day in women's health. So, estrogen, the bioidentical form of estrogen, which is called estriadol, is available in a cream, in a gel, in a ring, or in an insert. Those two things are kind of the same thing. There's also two other types of treatment for vaginal dryness or vaginal atrophy. The second is DHEA, which is another hormone. It's also goes by the name prasterone, and it's an insert. And the thing about DHEA is that when it's inserted into the vagina, it our bodies naturally convert that hormone into the estrogen and testosterone that we need. So a lot of women will talk to their doctors about using DHEA locally or vaginally instead of estrogen. And some people use both, believe it or not. And thirdly, and again, this is about choice, there is a an oral option. There's an oral treatment. So you take it orally for vulva and vaginal dryness. And I know at first I was like, what? How does that work? But I also know that the most important thing about these treatments or therapies is that we are compliant, that patients are compliant. And believe you me, we're not the best at compliance. Sometimes we really suck at it. So if taking something orally in the morning, let's say when you take other medications or other vitamins and supplements, if that's what's going to work for you, then know that there is that option on the table. This, you might want to screenshot this, or I can send it out with the replay tomorrow. But in the work that I do, I've found that, I want to teach the right names for things such as estriol and prosterone. But then when we get to our doctor's appointment, our doctors will talk in terms of brand names. They'll be like, oh, I'm going to prescribe you Vagifem or Imvexi. And you hear that name and you don't know exactly, is that what Shirley was talking about? What is actually in that? So I created this chart just for us tonight, and this is just vaginal. So this is estrogen taken vaginally, and then a list of the FDA and Health Canada approved products. I put Canadian flag just on all of them to make sure that you know they're available in Canada. Invexi is an insert. That was actually a picture of it here. That melts upon body heat. So it's inserted into the vagina and it melts upon body heat and then treats the skin cells of the vaginal lining. Exact same thing with Vagifem, although I have heard, I've not used Vagifem, I've heard that it doesn't melt always and everyone's body is going to be different, but just doesn't melt as well. But that's just hearsay. That's not an endorsement for one or the other. You get to pick. There's two types of rings on here and two types of creams. And then DHEA, I talked about the brand name for DHEA is Intra Rosa. That was, it's been used in the States for years and was introduced to Canada in 2022. And the oral option brand name is Osphina. And that was introduced to Canada in 2023. What's new? What do we have new to celebrate? Well, this is a mini celebration, if you will. Last year, 2025, after years of advocating, and some of you may have heard this, this is news from the United States. After years of physicians and consumers advocating, the black box warning, which is a warning kind of similar to what you might see on a cigarette package, that was applied to estrogen products, all estrogen products, including vaginal estrogen products, was removed by the FDA. And these are the experts who spoke at that panel and spoke to all of the research that we have. That warning is being removed not because the research changed, but because it never should have been there in the first place. And so the warning was a long list of you should not use vaginal estrogen because of its, risk of heart attacks and cancer and all sorts of things. And it was absolutely dead wrong. And it did impact an entire generation of women who were out of fear, and rightfully so, but out of fear not using the vaginal estrogen that is absolutely safe and that we are able to use for the rest of our lives. And and I haven't circled back to this yet. But I'll tell you, yeah, I'll tell you about that in a second. Just bringing it back to the story about my mom. So these are for local use estrogen products. There are no age guidelines. So if you require the treatment, you can use the treatment. They are recommended for a lifetime. The American Urological Association and the Canadian Urological Association have endorsed the use of vaginal estrogen. Why? Well, because your family doctor or your gynecologist might be speaking to you about vulvar, external vagina health, but your urologist might be speaking to you about urinary tract health. And what the urologist did when they produced the 2025 position statement on genitourinary health is they came forward and they all unanimously agreed that vaginal estrogen should be used for the prevention of reoccurring UTIs in postmenopause. So that was really good news from last year. And finally, that it is all safe to use post cancer. So, anybody that has taken a cancer journey, there is no need to continue suffering in that area of your health. It is safe to use. Third part, so one was hyaluronic acid, two is vaginal estrogen, three is see a pelvic floor physiotherapist. If you can't, you don't have one where you live, there are online programs such as this one from my friend Kim Botney. She is the vagina coach. She will also tell you to see a pelvic floor physiotherapist, but she also has excellent online teaching videos and Q&As every week, and just good for everyone to do both. I'm going to switch gears because when we get to that first line recommendation from the menopause societies, often what we'll see is that doctors are to recommend moisturizers or lubricants, and these two words get put into the same bucket as if they do the same thing, and that's not true. Moisturizers are away from sexual activity work. That's where they do their work. Just like when you're moisturizing your face or your hands in the morning or at night, you're moisturizing the skin cells of the vulva and the vagina because you want to support the skin health. And you know that hyaluronic acid has declined and estrogen has declined. Lubricants are for sexual activity. What they do is they're one-time use, so there's no long-term benefit, and they prevent friction, just like you prevent friction when you put oil in the frying pan. And you should do both, both. We benefit from both. This is the work, you don't have to read this, but this is the work that inspired a lot of the investment and education that I have done in hyaluronic acid and vaginal moisturizers. And it's from the Swiss gynecologist, Dr. Petra Stute, who has probably studied the benefits of hyaluronic acid the most in this world, and she has concluded that hyaluronic acid can be as effective as estrogen for treating vulva and vaginal dryness. I've found, however, in working with so many women in the Menopause Chicks community, that women in postmenopause just simply benefit from both. So while her study concluded that you could potentially moisturize and you wouldn't need estrogen, we now know that vaginal estrogen is recommended for the prevention of UTIs and for protecting the health of the urethra. And so I think it's very important that we keep both of those things on our list. This is from 2021. This is the International Society of Gynecologists, where they recommended to all their members that women are moisturizing with hyaluronic acid for vulva and vaginal dryness. And that made the moisturizer the first line recommendation. This is a moisturizer that Menopause Chicks has played a key role in developing. It was also new, relaunched in 2025. We started in 2018 as a result of a survey with Menopause Chicks in 2016, where I wanted to ask all my members what they wanted me to research and to study and to write about, thinking everyone was going to say sleep or brain fog because that's what I was dealing with at the time. And the results came back. Number one, we need more solutions for vaginal dryness. And then when I started researching it myself and digging deeper into that, I realized that less than 4% of women who were living with vaginal dryness had a solution. Less than 4% had a solution in 2016. I'm not sure that that number has really gotten any better. I know it's gotten better for those of you that are in the Menopause Chicks community, and I can only hope that that number is going to spike as we go forward. But it's one of the largest gaps in women's health. And there's a long list of reasons for that. We can be mad and blame the patriarchy and dismissal and disappointment rates, but I think what it really kind of comes down to where we can elicit change for ourselves and for systemic change is that conversations about vulva, vaginal, genital, urinary, pelvic health were simply not happening. So doctors weren't asking their patients about their concerns in this area, giving them a heads up to what might be happening. And don't get me wrong, I don't think that our doctor's office is responsible for our own health education. They're not handing out master classes by any means, but it wasn't part of a regular check-in, like, hey, how's your sleep? Hey, is your vulva and vaginal health experiencing any changes or concerns? It wasn't happening. And at the other end of that conversation is that we weren't bringing it up with our doctors. And I've spoken to so many people who said, no, I've never had that conversation with my doctor at all. So, that is changing because of folks like you coming out tonight and getting the information and education so that you feel empowered making the best health decisions for yourself. So we worked research wise, testing wise on a formula for vaginal moisturizer, launched it in 2018 as a compounded, launched it as Feel Amazing in 2022, knew that it needed a formula review. And so that has been relaunched in 2025. This is the new packaging. It's available at moisturizervagina.com or at ideservetofeelamazing.com. So that's the moisturizer part of moisturizers versus lubricants. Lubricants, something you want to use to prevent friction, do not undergo a lot of scrutiny. I'll be really honest. And there's so many, as you know, when you go down the aisle in your pharmacy, there's so many to choose from. So this is a little bit of a guide to help you with that decision because it's super important. The World Health Organization recommends that we're using a lubricant with a pH of between 4 and 5 and osmolality that's below 1200. Now, manufacturers don't have to report either of those two numbers in order to sell a lubricant. So that's disappointing because what do you do? If their website doesn't include the information, they don't have a receptionist answering the phone. I mean, like, is it just, spin and hope that you win? The best way that I can say to shop for a lubricant is don't go for anything fancy. Stay plain Jane. You don't want anything that has peppermint, mint flavored, enhancing. Those are going to be all take you to pH level of 6 or higher, right? So And maybe there is a customer service line for your favorite lubricant, and you can ask them, hey, what is the pH level? And I would hope that it's between 4 and 5. But the thing that you also need to know is that products have pH level, but the vagina has a natural pH level too, which is constantly fluctuating. So the reason why we want to use products that are close to that 4 to 5 range is because we want to keep the pH as healthy as possible. And what does healthy as possible mean? Well, it's like how quickly does the pH in the vagina return to that natural number range, 4.5? What can influence those changes? Blood. So if you are still menstruating, semen, and hormone changes. So that's going to affect our pH. And it might not be a big deal at all, or it could be a big deal if the pH gets, completely out of whack, and then you're facing things like discomfort and even infection. So something to know about choosing. Yeah, right. The most confusing aisle in the drugstore, I would say, and even more confusing because I am such a word nerd that this is what I grabbed off the shelf in my local pharmacy. It says, help to smooth external vaginal dryness. I think the copywriter and I should probably have a little chit chat, but the vagina is on the inside. So there is no such thing as an external vagina. I want to quickly take a minute. I realize we're just at the 10-minute mark, but I want to talk about incontinence for a second because the slide's old. It's from 2025. I remember when I was predicting this. The paper-based incontinence market is estimated to be valued at about $16 billion. You could probably do that math yourself if you've been in a big box store, Costco, Walmart, and you see the vast number of SKUs that are in that aisle for incontinence pads. 50% of nursing home residents are using paper-based incontinence pads, more females than males. This is a rough estimate, but it is probably $1,300 a year. I think that's probably conservative. And if you are experiencing or using these products for 40 years, it's probably going to uh, decrease your bank account by over $50,000. So if there is any way for you to prioritize your bladder health, have a conversation with your pelvic floor physiotherapist, especially if you're not experiencing anything and you think, oh, I'm going to be lucky. Go have the conversation. I went to my first pelvic floor physiotherapist appointment in 2019, I think. And I went because I wanted my members to see what it was like. And I was going to, record the conversation. And I didn't have any symptoms. And I walked out of that appointment with a diagnosis of a stage 2, 3 bladder prolapse and a rectocele. A rectocele is when the rectum bulges into the vagina. So it's one type of pelvic organ prolapse. And I thought I was asymptomatic. So it kind of goes to show that we don't have to be in discomfort or pain in order for there to be something wrong. But also the physiotherapy, the customized program that we got allowed me to make sure that those prolapses don't advance. And the exercises can kind of keep me at that level. So, very important, whether it's bladder leakage, pelvic organ prolapse, just go have the conversation. UTIs, I think I talked about, but I wanted to share with you. This was something I alluded to a minute ago. This is the brand new guidelines from the American Urological Association and the Canadian Urological Association has endorsed the exact same thing. They just didn't have a screen grab that was as good as this one. So these are the guidelines that physicians and urologists and gynecologists have in terms of what they should be recommending and offering to their patients. And you'll see under number 13, it says that for recurrent urinary tract infections, clinicians should recommend vaginal estrogen to reduce and or prevent future urinary tract infections. That was the information that my mother never got, and perhaps was the reason that she was experiencing those symptoms of what looked like dementia. So for you, for your mother, for your sister, for your grandmother, vaginal estrogen will prevent reoccurring UTIs. Then we can go back to that Ferris wheel and know that we'll be able to sit comfortably and move comfortably and dance comfortably and avoid reoccurring UTIs. And really, that's what it's all about. It's about preserving quality of life. Okay, I did it. I've got 5 minutes to go for questions. But if you have to jump off, that's okay. I'm going to stay until all of your questions are addressed. And as I promised, I was just, this is the story of the vaginal moisturizer. If anyone's interested, I can speak to that. Script tips. So I promised script tips. If you are making an appointment to talk about localized or vaginal estrogen or DHEA, there's a method that we have developed in the Menopause Chicks community over the last couple of years, actually. And it was really born out of research that told us that 54% of women in my age demographic, I'm going to be 59 next month, we're leaving our health appointments feeling dismissed or disappointed. And that number, over half, is even higher for Indigenous women and for women of color who might already experience dismissal from the healthcare system. And the top two reasons for their health appointment in the first place: menstruation and menopause. So long story short, it's very easy when we're having conversations about the healthcare system to quickly go to a place of blaming, blaming the system, blaming doctors, saying things like we need more doctors, we need to educate more doctors. All of that is true, super true. We need to change curriculum in medical school, also true, but that's not going to help the members of my community today. And so I was really challenged to be like, what can we do to change the system? Well, we can do it by each of us preparing for our health appointments in a different way, and maybe even changing the script that we use when we show up for that appointment. So I'll go through this very, very quickly. But this is the script tips method. You can learn more about it at speakmenopause.com, but it's basically two acronyms. So GAP, GAP is the first acronym, and SPEAK is the second acronym. So when you're preparing for your health appointment, obviously you're doing some learning or some reading like you're doing tonight. Then you show up for your appointment and you begin with G. Don't begin with symptoms. Begin with the goal of the appointment. It's the only way you'll know that whether or not you're dismissed or disappointed at the end. So it's like a measuring stick. So the goal of my appointment today is to talk to you about preventative treatments for UTIs. Okay, I want to make sure that I'm preventing UTIs. As you know, I'm 58 years old and my last period was in 2016. The reason that I put A and P there is it allows your practitioner to start gathering the data, and they're scientists, remember, they're starting to formulate a story, a health story here. If you don't repeat this information, they're going to be looking for it in their notes or on their electrical medical records. So just say it. Even if you've said it to them hundreds of times before, just repeat it. GAP, very quick. Goal, age, date of last period. Then go into speak. So S is for symptoms. Yes, you are going to say your symptoms. I have had 4 UTIs in the last year. Okay. P is impact. The second P here is impact. This is the piece, put an asterisk beside it, that I don't want you to forget. This is the piece that all of my members, when we began the research, were leaving out of their health appointments. And what happens when we leave out impact to your quality of life, is that it allows judgment to seep in. So, for example, if we were talking about sleep, a doctor might be like, "Oh, well, no one's sleeping these days. Shirley, you're just getting to that age. It's just part of being a woman." Yeah. And then you leave with this story like, "Oh, I need to suck it up," or "It's all in my head." But when you articulate the impact to your quality of life by saying something like, these reoccurring UTIs, not only are they painful, but they're impacting my social life. So I'm no longer going to yoga. I'm no longer going to, out with my girlfriends because it's just too uncomfortable. And this is impacting my mental health. Like, right there, there's like 3 things that a physician's going to be like, whoa, this is serious, and we need to provide her with a solution today. And then EAK. So E is for education. You can say, I went to a vulva and vagina dialogues class the other night, and that I learned that vaginal estrogen is approved for the prevention of UTIs. An affirmation, you can say, I know that I deserve to feel amazing. Or if you're talking about something else like incontinence, you could say, I know that I'm not meant to pee my pants. If you're talking about sleep, you could say, I know that I deserve to sleep 7 hours in a row. Or you can just say, I know I deserve to feel amazing, because that's my favorite. And can be okay, now what? And you're asking them to contribute to the conversation and to the recommended solution. Or K could stand for key next steps. So sometimes in our health appointments, there's more than one thing that we need to do. So key next steps. And you could say something like, I'm inviting you to work with me to help me decide what is the best next step for me. This is a fill in the blank. It's kind of like ad libs. And if you go to speakmenopause.com, it's really grassroots right now, but you can fill in a few of these answers, and it will email you a script. And you can take that script to your doctor verbatim, or you can adapt it to suit your personality or to suit your relationship with your doctor. So let's get to your questions. How's everybody doing? Let me get this open here. Okay. Francis says, what and how to get my gynecologist on the same page for estrogen and progesterone. I'm not sure what that means by same page. Um, do you want to turn your mic on, Francis, or do you want to just add something more into the chat? I'll come back to that one. Tamara says, thanks for the tip about bump on Monday. You made an appointment. That's amazing. She's referring to Bump Physio, which is my own pelvic floor physiotherapist here in Port Moody, and they have locations in Langley and in New Westminster, if anyone is interested. But finding a pelvic floor physiotherapist is really quite easy. You can Google, obviously. You can ask a friend. You can ask me if I know anyone in your area. But you can also go to a physiotherapy office or physical therapy office in your neighborhood and ask them if they have a pelvic floor physiotherapist on staff. If they don't, there's a really good chance they'll know someone close by to direct you to. Please send as very small. Oh yeah, okay, I will definitely put it in the replay tomorrow. The names of all the vaginal estrogen products and their brand names. So why are doctors still resistant to prescribing? I think that's probably a rhetorical question. Doctors have a prescription pad and they are licensed to prescribe. There might be resistance with some physicians who haven't yet experienced training, or maybe their whole patient panel is, been in pediatrics and they haven't yet been working with a lot of midlife women. I don't know the answer to that, but I do know there's definitely a move towards, if not all, many prescribers and physicians getting the training that they need. And it's like peer-led training, which is amazing. I know a couple of folks who are providing that level of education, and it's amazing to see the numbers that are signing up. And I don't know where you live, but I also know that we've seen. We didn't include this in the conversation tonight, but some of the other things that happened last year in 2025 is, for example, the Ontario government has put out guidelines to all of their doctors on what the first line recommended protocols should be for menopause. That's groundbreaking. And, I think that we will see more and more of that as we move forward. And then I think we have to be somewhat responsible for our own care. So if you are sitting in a room with somebody and you are experiencing that resistance, there's definitely things that we can say to move or to advocate for ourselves if that is in most cases, especially in Canada, you can't get a second opinion. You can't switch doctors. There just isn't that supply and demand that's available. So work with the one that you've got. And if I can provide guidance in terms of personalized script tips or phrases that you can say in that appointment, you can reach out to me anytime, Shirley at menopausechicks.com, and I will try to make sure that we can take the education you got tonight and augment it with some script tips so that you can go into that appointment feeling as informed and confident as possible. KS says the Buff Muff program is excellent. So, what she's referring to is the program by the Vagina Coach. So, if you want to get curious about that, you can learn about it at vaginacoach.com. And the program is called Buff Muff. Can you talk about lichen sclerosis and treatment after diagnosis? A little bit, Karen. And a really great resource is the BC Vulvar Center. I'm just going to start to make a list of things that I'm promising to send you in the replay. But I do work with a gynecologist there, and lichen sclerosis is one of the most common vulvar skin conditions. Once it's been diagnosed, it's usually treated with a topical, is it cortisone? The name's not coming to me right now. I think it's topical cortisone. And I can confirm for you that using that and using a moisturizer and using vaginal estrogen is all approved. You just probably would be applying those things maybe at different times of the day, but it's all possible. There's a really great patient handout at the BC Vulvar Center too, along with a list of other vulvar conditions if anyone's interested. Can you recommend a pelvic floor therapist in the Tri-Cities? I think you mean the Tri-Cities of British Columbia. Yeah, Bump Physio is where I go. I mean, I'm not, you can do your own research, but if that's an easy one for you, they have 3 locations in the Lower Mainland. Oh, great question. So Krista's asking, has Health Canada also taken off the black box label for estrogen products in Canada? The answer is no, not yet. So this decision in the US just came out in the fall. I think the I think the expert panel was in July and the decision to remove the box label was in November. So it's probably not even happened yet in the US. And I do not have any information as to where Health Canada is in that decision-making process. I heard a little bit about what their protocol is in terms of engaging expert opinions before they do that. But we know from some other examples that are not the same, but maybe similar, is that generally speaking, Health Canada will follow the FDA decision, but also it wasn't supposed to be there in the first place, which is a really long story. But yeah, so I'm very optimistic and very hopeful that we'll see that in Canada soon. Core Kinesis pelvic floor physio therapist. That's great. In North Coquitlam. Amazing, amazing, amazing. Any North Shore recommendations? I can't think of her last name right now. Jillian. Yeah, just Google North Vancouver. There's lots. So good, thank you. What medications contribute to dryness? No idea. I mean, probably a lot. I've heard that some SSRIs, some antidepressants might contribute to dryness. And sometimes, like the dryness, might show up first as eye dryness, right? So if you're on a medication that's causing eye dryness, then it could be causing dryness in other places as well. But for most of us on this call, if you're not in postmenopause, then you could look at the medications that you're taking. For most of us on this call, I think we can safely say that we can benefit from looking at moisturizing with hyaluronic acid, making sure we're on vaginal estrogen either as a treatment or preventatively. And then if that's not working, we can work on a personal care plan for you, which might involve reviewing medications that you're taking. It might involve reviewing doses and understanding whether or not you can tweak the dose. So I say that because it's come up a couple of times recently where um, members have been prescribed vaginal estrogen, which let's just say I'm not a prescriber, so I can't talk about doses, but let's just say you were instructed to use it every day for the first 14 days and then switch to twice a week. And we do that, we follow the instructions literally, and we realize this still doesn't feel like great. Like I really want to feel amazing, and I don't yet. And we don't know that it's okay to go and speak to our doctor. Can I increase this to 3 times a week? Or can I increase the dose to something? So don't settle, is my message. I wanted to thank you for all your hard work and for making this confusing subject so much clearer. Oh my gosh, I just want to jump through the screen and give you a big hug. That's why I do it. Thank you so much. Thank you so much. Yes, are there any in Maple Ridge? I'm not sure, but right across the bridge in Langley is in that little section of Langley is where Bump Physio is. I feel like I'm doing a commercial for them tonight, so they'll be really pleased with me. What is the name of the clinic in Langley? It's Bump. Amazing. I'm 74, UTI several years ago. Is it advisable for me to go on vaginal estrogen? I use a vaginal moisturizer and have used feel amazing. Well, here's the thing. You get to make up your own protocol. You are in the driver's seat of your health. You now have all the education and you get to decide. Some members of my community will definitely go for both. Some will use the moisturizer and it just works for them. And they might not have a maybe they don't have a family doctor, maybe it's just a pain in the whatever for them to take the next step. And then maybe one day, 6 months from now, they'll be like, I'm just going to ask about it today, and they go for it. So the answer is yes, it is advisable for you. There's a really good chance that the moisturizer is also taking care of the skin around your urethra. It's just that it's not approved for the prevention of UTIs. So that's why, because, our cars in order to run optimally, need gas and oil. And our pelvic floors, in order to run optimally, need hyaluronic acid and estrogen. That's it. And sometimes testosterone, but I don't know if we have time to get into that conversation tonight. Is there a recommended age or something to move off of systemic hormone therapy and just use localized? No, there is not. There is no guideline for age or for how long you can stay on systemic hormone therapy. And there is absolutely no age guideline for when you can start, and ever, you should never stop using localized or vaginal estrogen the rest of your life. Thank you so much for this discussion. I've been following along with Menopause Chicks since the beginning. I know you have, Justine. Thank you so much. When women start to take estrogen, vaginal gel, creams, inserts, will their doctors need to adjust their current doses of menopause hormone therapy? That's an amazing question, and I don't think I've had it for a long time. So kudos to you. No, you don't. So when we take estrogen or vaginal hormone therapy, it doesn't cross the blood barrier. So it's called localized therapy because it treats where we put it. And it doesn't impact the systemic hormone therapy that you're taking, like your estrogen and your oral progesterone. Shirley, I took the master class 2 years ago and it changed my life. I went to the doctor with the script and got what I needed. Since then, I have added more, and now my doctor is asking me for information. And open to hormone therapy and treating other menopausal women. Thank you for all you do. Oh my goodness. That is just so amazing. Thank you so much, Debbie. Thank you for being here. Oh my God. Who is the physiotherapist you recommend at Bump? I can't recommend a physiotherapist, just like I can't recommend a husband or a hairdresser. You have to interview them and find out who gives you the best energy. So, if you want to, and I suggest that we all do this with our healthcare providers, ask for a 10-minute get to know you appointment because these are intimate conversations often, and you have to have good chemistry with them. Otherwise, your health outcome will be impacted. If you have anxiety, you're not comfortable with the person, there's anything that's just not giving you good mojo, move on to the next one. So do ask if you can have a meet and greet and find the one that's going to be best for you. I have to drop, so thank you for this helpful information. Do you need to take progesterone when taking or using estriadol? So if you're questioning systemic hormone therapy, which is kind of not what we were talking about tonight, but if you're taking systemic estrogen, you absolutely have to take progesterone to protect the lining of your uterus. Estrogen cannot go unopposed. If you do not have a uterus, you can still take progesterone because progesterone has lots of benefits. It supports our mood, supports our sleep. It invests in our brains, it invests in our bones. So that is that. Anything that happens with regards to vaginal estrogen. So if you've been prescribed vaginal estrogen, you do not need to increase your progesterone, and you do not need to take progesterone suddenly if you haven't been. I hope that I explained that well because this comes up a lot at the pharmacy counter. Unfortunately, women will get to their doctors, they'll take the master class or the vulva and vagina dialogues, and they get the prescription, and we've got their information at that optimal level, we've got their confidence at that optimal level, and then they get to the pharmacy counter, the pharmacist tells them they can't have their vaginal estrogen unless they're taking progesterone. That's absolutely wrong. And the reason it's wrong is because of the question we had a minute ago, is that vaginal estrogen products treat locally. They do not cross the blood barrier. Okay. Let me know how I did. I'm going to take a drink of water. I have to drop. Thanks for this helpful information. You're right. You're amazing. I thought you were going to show us how to use estradiol on the mannequin vagina. Well, I can. Um, this is my vulva puppet. I also got a new model. Sorry, I got a new model this week, which is more real to life, which I like. Um, but this one feels comfortable for the screen use. So vagina is inside very often. I didn't like belabor it tonight, but the language around these body parts often gets confused, not just in products, but in the doctor's office. Sometimes everything below the waist is referred to as the vagina, which is not true. It's the internal part. When we are moisturizing, we are going to put product on our finger, maybe one pump on our finger and insert it, and then one pump on our finger and moisturize external from the clitoris to the anus. Or you could put two pumps on your finger, moisturize inside, use what's left over, and moisturize externally. On the slide that explained all of the products for vaginal estrogen, there are different modes of delivery. So there's gels, there's creams, there's rings and inserts. I think rings and inserts are pretty much the same. And I've never used one and I don't know anyone who's using one, but I can understand why you might choose that if you want to talk about it for a minute. A ring or an insert is a slow release form of estrogen. So it's insert it and forget it. I think it's for 3 months. Sometimes it can be inserted yourself, sometimes it needs to be inserted by your physician. So that's an option. But most people will use the suppository kind, which is either Imvexi or Vagifem. And the instructions come with that product, but generally speaking, you insert it into the vagina either with the applicator or with your finger, and they melt upon body heat. And you're most likely doing that 2 to 3 times a week. If it's a cream, which is I have here, which also comes, this is estrogen, I'm sorry, I need a new one. Also comes with an applicator, but I don't use it. I recommend that you use your finger the same way you apply the moisturizer. And the reason for that is because A, don't want to waste product on the applicator, but also it allows you to make sure that all the skin cells, because they're the same skin cells, whether they are internal or external, are benefiting from that product. How'd I do with that? Okay. I don't use, oh, sorry, I should have read all your question. I don't use the applicator. I use externally, though. You said external is not a vagina, but don't know if I'm doing it correct. I'd say, how do you feel, first of all, and then two, keep up the good work. By the way, checked. We've been colder on New York City than your city. Oh, absolutely. Yeah. Yes, yes. Today, I think oh, it was 10 or 11 Celsius in Port Moody, British Columbia. Do you recommend putting estradiol on your face? Oh, I don't. Um, I think that I'm going to live long enough to probably see an approved estrogen product for facial use. Right now, I would not recommend that you use it on you anything on your face that's not meant to be there. And even more so, I would emphasize that please don't use anything on the vulva or the vagina that's not designed or approved to be there. That's really important. Um, this estrogen that I apply to my arm every day, it's like high alcohol. So it's not really something I'm interested in putting on my face, right? And my products for my vulva and vagina, I'm not going to waste them on my face. My vulva and vagina health is too important and I pay for that. So yeah, that's my answer to that. Oh, my skin looks great. That's because I'm on Zoom. It's a Zoom filter, I'm sure. But thank you. I love you. Thank you for talking about moisturizers. My doctor, gynecologist have not suggested this at all. Yeah, I'm not surprised. A lot of doctors, I mean, a lot of them just don't know personally and they didn't receive the training. So it's okay for you to educate them. When you do, give them this. And that's why I have the E in the Speak Menopause script tips, is because like when the first time we learn about something is the first time we learn about something. And when you can educate or at least share your lived experience with your doctor, it's going to benefit you and all the other women in their patient panel who follow in after you. So that's why I'm like sort of this dog with a bone where I really want everyone to work with the doctor that they have, even if the experience has been like less than ideal. Even if it was a little bit dismissing, but you can tolerate it. If you can get to that aha moment where they're like, "Oh, I didn't know that," and really that worked for you, and oh, and it's approved, and you just showed me where it's approved. Now I can use that for all the other women in my patient panel. So I love that. How do you know it's a UTI? Great question. I have heaviness, ache, and incontinence. It's probably tight pelvic floor. Hey, no prolapse. I don't know that. So you need a you need a pelvic floor physiotherapist to help you diagnose that. Heaviness is definitely a symptom of a potential prolapse, but it could be something else. Ache could be something else. Incontinence is incontinence and it can be reversed. So I would encourage you, if you can, to do whatever you can to reverse that. A lot of things can't be reversed. A lot of things we're like, we can keep them there. But if we can treat something and actually turn back the clock, and incontinence is one of those things, go for it. Um, I like that you said this because it gives me an opportunity to talk about it. It's probably a tight pelvic floor. That is a very common assumption. We don't know until we work with a pelvic floor physiotherapist whether it's too tight or not strong enough. And so it's really good to be assessed and to learn the tools, the tricks, and the exercises that you can use. And when I say exercise, yes, I do mean taking 10 minutes a day to exercise, to use the tips and tricks that you get from your physiotherapist. But I also mean, and this has been huge learning for me, what we learn through that process helps us when we're picking up the kid or the dog or lifting the groceries out of the trunk of the car or all of those everyday things that we don't know are actually impacting our pelvic floor either in a negative way. So get curious and find out if you can. What about reaction to estrogens? I don't know what you mean by that. Any pelvic floor physiotherapist in Calgary? I don't know, but I have heard of Mod Medical in Calgary. Amazing. I love it when people can chime in here. Aloe Cadabra, never heard of it. Aloe is not on um, the International Gynecologist list of recommendations or the Menopause Society, but I do know that it is included as some not as non-medicinal ingredients in some moisturizers. So I say hyaluronic acid because it is such a strong molecule, and we know that the body doesn't make aloe. So you're not giving your body back something that it used to make on its own. With hyaluronic acid, you're giving your body back something that it used to make on its own. And because it's such a strong molecule, can carry 1,000 times its weight in water, that the moisturizing activity over time, or if you use it like 3 times a day to start, because it's a moisturizer and you get to make up how you use it. If you use it 3 times a day to start, you know that you will be able to go back to maintenance mode once dryness is treated. And I think that's the really cool thing about using the approved products, as opposed to coconut oil, for example. By the way, lots of doctors still tell women to use coconut oil. I need to tell you, it does the same thing for the vulva that it does in the frying pan, and that is it prevents friction. So if you want to use it to prevent friction because you love coconut oil and that's your lubricant of choice, that's okay. But it has never been tested. No food oils, avocado, coconut oil, you name it, no food oils have ever been tested on the vaginal biome. So we don't know about pH, we don't know about reactions, whatever. We do know that hyaluronic acid and vaginal estrogen are approved. Is it possible that you could be sensitive to Premarin versus the other estrogen cream? Yes. So Premarin is not bioidentical. It has a different molecular structure. It acts like an estrogen, but it's not estriadol. So if you're having a reaction to Premarin, know that there's all the other products that can be prescribed by every healthcare professional and that are available at every pharmacy. So you've got lots on the menu to choose from. And yeah, you don't have to stick with that and you don't have to suffer. Thanks so much for this great session. By the way, I had to use my husband's phone for this session. My name is Kathleen. Well, I hope you and Scott have a good night tonight. I'm here. I need scripts to convince the doctor to keep prescribing estrogen in the form of Agifem, and I'd like hormone therapy. How to get this accomplished? Okay, Francis, we can do that. I think that we're just getting close to the half-hour mark. So why don't we do that offline? Send me an email, shirley@menopauschicks.com, and I can definitely help you with the script for your next appointment. I just started localized estrogen this week. I look forward to feeling the full results. Will there be a promo code given tonight for the, oh, talk about pressure. Yeah. I'll do that, Kathleen. I'll put one in the replay. How's that? Wow, everybody thank Kathleen. Is there an approximate age that UTIs stop being painful? How will we know if we have one? So typically, the symptoms associated with the UTI can vary. When we're younger, sometimes it's after sexual activity, we might get a UTI, might be pain with peeing, it might be more frequent urination, or it might be nothing at all. So the bacteria, the bacterial infection can exist without pain or obvious symptoms. It's really hard to say why older people, especially, can show symptoms of forgetfulness and cognitive decline. I'm wondering, I do not know this, but I am curious if it's because, in the case of my mom, for example, she had years of infection treated sometimes with antibiotics, but untreated as well. And I'm wondering if that like legacy of infection in her body changes how the symptoms show up. I don't know that. I'll get curious with some folks that I know, but I don't think that there's any prescribed box that says when you're this age, it'll look like this, and when you're this age, it'll look like that. I think it's all individual. It's been so much fun, you guys. I absolutely love doing this. And I so appreciate that you came out tonight. So thank you for your thank yous. Amazing. Here in BC, which vaginal estrogen is most cost effective? I don't know the answer to that. It'll depend on the pharmacy. You can ask a pharmacist in advance of your appointment. If you're looking at the menu tomorrow and saying, I'm going to talk to my doctor about Imvexy, for example, you could go to your pharmacy and ask how much it costs before you go to your doctor's appointment, if that's a concern. You can also take those brand names and if you have extended health benefits, and you can pop them in to your extended health benefits program, and or call them or email them, see if you can get a response to what's covered. But it's going to vary. I don't know. Thanks so much. Grateful for the group. Thank you. Thank you. Thank you. Thank you. Okay, I gotta go make my list of things I promised to send you. Is Gynatrop Vulvar Cream good? My mom is over 90 and UTI frequently. Your mom needs vaginal estrogen. Gynatrop is a form of vaginal moisturizer that you can buy off the shelf. The first ingredient on the list, if you look at the ingredient list, is water. Water is drying, and water keeps us coming back to buy more moisturizer. You know, if you wash your hands over time, how many times a day, how much more moisturizer you have to use. And Mary, if you need a script, if you're your mom's advocate or she needs a script, happy to provide that so that you can have hopefully a really good outcome at your doctor's appointment with her. My first time listening, so appreciative. Thanks for all you do. Do. Oh, we got to the end. Yay. Thanks, everybody. Have a good night.